Hi, good evening, everybody. My name is Jeremy Boal. I'm the Chief Medical Officer for the Mount Sinai Health System, and with me is David Rich, who's the President and Chief Operating Officer of the Mount Sinai Hospital. I think we'd like to spend a few minutes with you, updating you to the extent that we can, given confidentiality, on the status of the patient who's with us right now. And with that, I'll turn it over to Dr. Rich.
Good evening. A patient came to Mount Sinai's emergency room in the early morning hours with symptoms of fever and recent travel to a West African country. The patient was promptly isolated and placed in a strict isolation facility at Mount Sinai such that we could protect the patient and also any staff and other patients in the facility and all visitors. We're very confident in that our work with the federal, state, and local authorities will lead to a prompt evaluation of this patient, and that we'll be able to hopefully find that there is a more common cause of fever and other symptoms that the patient has. Using an abundance of caution, we're going to work carefully with the CDC to make certain that this patient does not have the Ebola virus disease.
Thank you. And with that, we'd open it up to questions.
Yeah, how long is it going to take you to determine whether or not he has Ebola? Is it 2 days, 3 days, 4 days? What are we talking about?
Sure. Well, the first thing we'd like to stress is that odds are this is not Ebola. It's much more likely that it's a much more common condition. We're ruling those things out as well. In conjunction with the CDC, who's been guiding us on the testing protocol, we're sending specimens down to them, and we expect an answer hopefully in the next 24 to 48 hours, although we can't guarantee it.
Now, if it does turn out that he has Ebola, what happens then?
The treatment of Ebola is a symptomatic treatment process, and so we already have this patient in a special facility where all supportive treatment could be given, as would occur at any hospital in the nation.
So he wouldn't then have to go to Atlanta like these other two folks coming from Liberia. He would be flown down to Atlanta.
No, we believe that the care that could be provided here would be sufficient for any patient with that disease, but we're of course hopeful that there'll be a rapid recovery and this turns out not to be Ebola disease.
Have you already sent samples to the CDC? Has the CDC already received those?
The samples are in process right now.
Okay, when do you think the CDC will get those?
My best guess is it'll be sometime tonight or tomorrow morning.
Is there any testing being done of those who were in close contact with this gentleman? His family, friends, people he was with?
The patient was isolated very promptly in our emergency department, so we don't feel that any testing is necessary for anyone who might have come in contact casually with the patient for a few moments in a waiting room. However, we will be working with the patient's family members and advising them as to the CDC recommendations for screening, which are basically checking for fevers twice a day for a certain number of days.
Can you explain how the disease is transmitted for those who might not know?
Well, the disease is transmitted not by casual contact, it's by contact with bodily fluids. And although I don't want to go into great detail, in the African nations where it is prevalent, it is something where people who've been in contact with funeral arrangements, with dead bodies, or who have been in touch with major bodily fluids are potentially at risk.
When did this patient get back from West Africa?
Well, you know, we need to be very cautious with regard to confidentiality, but we can tell you that it was in the last month. We can't tell you that it was in the last month, but we can't give you specifics due to patient confidentiality. I'm sorry, go ahead. I want to make sure somebody else gets a question in.
So when and how did you find out? I mean, what are the procedures you have in place? Because anybody can come into the emergency room with these kind of symptoms.
Well, because of the alerts from the CDC, we had done extensive preparations over the weekend, and our group had several conference calls in preparing for the eventuality that a patient could walk into our emergency room or any emergency room in our health system with these types of symptoms. So I just would compliment the team at Mount Sinai that had done excellent preparations for such an event.
Can you talk more about was he a resident of New York City? Can you tell us that?
We can't comment on any details regarding the patient, just to protect privacy.
And also, can you talk about what the isolation room is, what's in it?
We can say that strict isolation is such that any bodily fluids and any droplets are prevented from contact between the patient and the staff. and that there is a room outside of the immediate room where the patient resides, such that the staff can appropriately prepare for entering and leaving the room.
What do they have to wear when they go in?
Excuse me?
What do they have to wear when they go in?
I prefer not to go into the strict details, but there are publications we could refer you to on what strict isolation entails.
Again, what do you think is the most important information the public should know about this case here?
I think the most important thing is that people should understand that if this were a case of Ebola, which we do not know, that it is not transmitted by casual contact. And that everything that happened at Mount Sinai happened in a very rapid fashion, such that we were certain that the patient did not pose any risk to other patients or to our staff or to visitors to Mount Sinai.
Do you think there's any reason people outside of the emergency room should be concerned? Someone who could have had contact with this person on the street or the subway or taxi?
Well, to reiterate, a casual contact is not a mode of transmission for this disease. So, although I cannot speak to what the patient did before the patient arrived at Mount Sinai, casual contact clearly is not a risk factor.
Could Mount Sinai handle the case of Ebola? We haven't trained.
Yeah, I believe we did answer that, but yes, we believe that we have all of the necessary facilities to treat any patient with Ebola disease.
And when you had a case of Ebola at Mount Sinai, have you looked at anybody else that had symptoms of Ebola?
Thus far, we have not had other patients who had similar symptoms and travel history.
When you have Ebola, how soon after it do you start showing symptoms?
I will defer to my infectious disease expert friends, but I believe that the incubation period is quoted as, help me?
2 to 21 days.
Thank you, 2 to 21 days. Okay.
Go ahead, you had a question?
Like when someone walks into the ER with symptoms like this, what's the protocol?
It's a great question. So, again, I think, the way that you prevent something from causing more of a problem than it should is by planning ahead. And so we spent a lot of time over the weekend, a number of the folks who are in this room, on calls, making sure that we had the right protocols in place so that any patient who arrived was immediately screened for travel history, and this is ongoing, travel history and symptoms. And if they had those things, they were immediately put in isolation before we had any other information. Even if it turned out that they were low risk or no risk, the idea was to isolate them as quickly as possible. And in this case, that's exactly what happened. It was about 7 minutes from the time they hit the door to when they were in isolation room.
How's the patient doing now?
Well, we cannot comment on the patient's condition, but it is good condition. We're not concerned at present.
Is there any, be looking at anyone who came on the airplane with or any, I know you said close contact, but anyone that?
So with regard to the contact issue, we're in very close contact and collaboration with the city DOH, the State Department of Health, and the CDC. And, our responsibility is to the patient that's in front of us. We share all the information we have with those entities. They're helping us to make sure that we're doing things the right way. And then they'll use that information to figure out what else should be done with regard to any contacts. But again, from our understanding is that casual contact is not a risk factor.
Can you say how many of his family members were there with him in West Africa?
We can't comment.
We
can't comment.
We cannot comment on any of the details regarding the patient's history.
How did he come into the ER? Was he by himself? Did he come by ambulance? Did he walk in?
Well, once again, we really cannot comment on the patient details.
So I know you mentioned this, but could you say again, so the patients who were in the ER at the time, even though it was very quick and there was no casual contact, have those patients all been notified, or when have those patients been told, and what are they supposed to do?
So what they should do is nothing. Again, there's no risk to them from casual contact other than what they normally do. And I want to stress that it's absolutely important for people to understand that there really is no risk imposed by being in an emergency room, even prior to isolation with a patient, particularly one where there's such a low risk of this being Ebola. But even if it was, that's not really where I think our concern needs to be.
What time did he come in?
A patient came in the early morning hours.
Just so you know, there's a question coming in on this phone. Go ahead.
Yeah. Hi, I'm calling from the Atlanta Journal-Constitution. Can you tell me, first of all, which of you said that it's likely that it's a much more common condition? We can't tell which of you is talking.
That was me, Jeremy Boal.
Thank you very much.
My pleasure.
Also, I'm calling from Atlanta, where we've got 2 Ebola patients here, and we've had a lot of, nice detail about the rigor of the isolation units here, the Tyvek suits, the sealed anterooms, the windows that patients can speak to outsiders through, and we've also been told that this is the only one of 4 such facilities in the country that can handle patients with level 4 pathogens, or I should say that are built to handle the level 4 pathogens. That said, people have also been clear that this, may be overkill for Ebola, which is not transmitted through air. Can you give me a little bit of detail about what you have exactly in your isolation unit as far as, are people wearing those kinds of Tyvek suits and the construction of the isolation unit? Does it approach what we have at Emory, and are you at all concerned?
So the short answer to the question is that we're not concerned at all. We know that the isolation procedures that we're using are absolutely safe with regard to the patient and to the staff, and that we're in close contact with the CDC and the city and the state, and our staff feels safe. And nobody has refused to treat the patient appropriately because we know that we're using the right precautions. But I won't go into details about those right now. Thank you.
I would also add that we have been in contact with colleagues at Emory who shared their protocols with us. And I would also add that we're extremely proud of our staff who showed compassion and professionalism in preparing to treat this patient on relatively short notice, and that we are really very happy with all aspects of the care that have been given thus far at Mount Sinai, from the preparatory work that occurred over the weekend to the rapid response of a very large number of individuals who worked tirelessly today to make sure that this patient was cared for at the highest level of professionalism. Thank you.
Thank you very much. Last question, I'm sorry.
Sorry, no
We
details.
can't comment on anything that would be identifiable.
Yeah.
I'm sorry.
Yeah.
Thank you all very much.
Thank you.
Thanks.